practice, this is more common and useful in the vatvyadhi treatment. We can do something better. Remember one thing. Somebody developed ischemic condition in the brain and develops in the nervous system and it leads to hemiplegia or paralysis in a place. If immediately treatment is given, nowadays available, within as early as possible, within half an hour at least, so he will totally recover. Generally, this is related with the emboli. Embolar cholesterol material blocking the blood vessel, and this makes paralysis. Brain itself cannot feel any pain. All the body gets the pain with the disturbance, where brain is not feeling the pain. So suddenly patient develops the things. And another serious condition is that is the bleeding in the brain. The bleeding doesn't stop immediately. Once the opening of the blood vessels are there, so it will continue at least for hours. If any clotting disorders are there, still again problem. In this condition, case is little fatal, difficult to recover. And whenever you practice in the clinic, just observe, give the primary treatment and immediately refer to the big hospitals because of the SSR complications. Still, you should know what is to be done, what we can help to the patient. So in the modern, we are not authorized for the modern medicines. If you are allowed for the modern medicine in the emergency, you can give, there are simple medicines are there. And remember, if the bleeding is there in the brain, if you are giving any coagulants, how you can difference between the occurred due to the emboli or the blockage in the blood vessels. In the blockage, generally they give the aspirin or disprin that dissolve the clots and makes the blood supply normal. If there is bleeding, you are giving this treatment, again it may be complication. The simple thing, differentiation is the complaints suddenly starts and stable since the starting, half an hour, there is no change. Otherwise, they start with a very few complaints, little complaint of the finger incoordination, visual problems or such things, and time to time it is increasing. Another system enoli means there is an increase of the foci in the brain. It is generally related with the brain. These things we should be careful. Assess the clinical findings, then we can have an idea. If you are able to read the modern books related with the paralysis, related with the cerebrovascular accidents, CVA, it is known as CVA. So it is better to diagnosis. Treatment, let us say, for the treatment purpose, Ayurvedic diagnosis are better, not for in the modern view. We can compare, but there is definite change in the Ayurvedic concepts that we can do. So in emergency condition, just aware what to do, what and not to do. Otherwise, patients will cry as the doctor spoiled the case. So just aware. Otherwise, apayashas may be there for that purpose. Now, these CVAs present. You can stop. Do you feel hot? Oh yeah. No, for me it is due to the cold wind. No, continue it. Now it will not come. And common differentiations we have to do. Generally we can tell quadriplegia, monoplegia, whatever may be. But in our view, we should aware what is the disease. So I have differentiated these points from the Charaka and Ashtanga. Sushruta is the same. Ardita, Pakshagata, Ardhangavata, Ekangavata and Sarvangavata. These all are similar conditions. Some are severe. Ekangavata is comparatively very less severe. More than that Ardhangavata, more than that one Sarvangavata, and Pakshagata is more powerful than the previous one. And Ardhita is the most potent disease and having so many properties. How this differentiates? See, first Ardhita is having so many pathological factors and symptoms. It is having deep-seated, we can tell. Vatasya balavat prakopa. Here the nidana is Vata Prakopa is very powerful. It may be Avarana, it may be Dhatu Kshaya or Adjogamanadi Vata Prakopa Karana. And in this one, Sharira Ardha Grana, half part of the body is affected. Can you read this?
Sir.
Today I written in small letters. Sharirada Eke, one part of the body or half part of the body is affected, or Mukharda, half part of the face, half part of the body, or any one or any one part is affected. It may be half part of the face, half part of the body, either side, any side may be affected. See, not only one anga, not only one hand or one leg, it is half part of the body. Asrat, in the pathology, Asrat, blood, Lasika, Sira, Snayu, and this inner side, and Bahu, Pada, Jana, this is the extremities, becomes Shosha, wasting will be there. And Jivha, Mukha, Sati Sankocha, tongue becomes Kutila, Vakrata, or Sankocha, constricted. This makes difficult in the speech. Ati Sankocha, it is not a little, it is very Sankochita, he cannot protrude it. Nasa, Bru, Lalata, Nasa, Bru, Lalata, Akshi, Hanu, Vakrata, Akshi or Hanu, one side. One is normal, other side is which affected side, it will become Vakrata. Lalata, facial. This is facial paralysis, we can find these things. But in the Ardita, these all symptoms are there, then we can tell as Ardita. Stabda Netrata, affected side, eye, movement is lost, stable. Pada, Hastu, Akshi, Janga, Uru, Shanka, Shravanaghana, these places having severe pain, aching type of pain will be there in these places. Dantachalpa, movement of the teeth will be there. Teeth will not move, the Hanu, it will move. You want to try to any movements, it will move only. You cannot open it fully. Dantachalanti, this is moving. Mukharde or Sharirarde, Vyadvyadhi Lakshanani. Face or body, one side is symptoms will be more. Maybe left side of the face, right side of the body, maybe there. Or only face or in the body. And Sajjati Vak, the sound is suppressed, means avyakta. This sound or words is avyakta. He cannot clearly talk. Samukshipta Kala means Atitvarita, Samukshipta means Atitvarita. Vak, speech is slurry or fast, he want to speak, he is not having the coordination. The slurring of the speech will be there. Lakshana Adhika, symptoms all are, maximum symptoms will be there and it is powerful symptoms. Indriya Avayava Vikriti Adhika, these are more. Symptoms are more in this one compared to the others and Vikriti also more in this one. Dosha in the pathology, comparing to others, Dosha Balavattara Prakopaha. Dhatu Kandaradi involvement are more, not mild. It is severe involvement of the Dhatu Kandara. And Sankocha Pradhan, this is spastic. Ardito Vekitaya Na Sarvakalam Bhavati. In the Ardita, the symptoms are intermittent. Sometimes it is lesser, sometimes it is severe. But the dosha, vatvyadhi, involvement of the dhatu kandara, all, whole body is the same. But its appearance in the half of the body. The vata only in one side is affected, one side vata, it is not so. All the pathological factors involve the whole body. But due to the dosha prabhava, vyadhi prabhava, only one side we can see the symptoms more. And sometimes the vega is severe, sometimes comparatively less. Sankocha more for some time, after some time it is less sankocha. There will, but it's compared less. This is known as remittent. Remittent or intermittent symptoms are there. So it's telling ardhito vegitaya na sarvakalam bhavati. These are the difference between others. This is the pathology. Okay.
So, sir, ardhita we can conclude that this is hemiplegia. It's not Bell's palsy. No?
Bell's palsy in Ashtanga it is termed as Bell's palsy. Ashtanga, this is from Charaka.
Because the symptoms is not correlated with Bell's palsy.
Bell's palsy in ardhita, see, yeah, half of the face only. That is written in the Ashtanga Hridaya. In Ashtanga he is telling ardhita is Bell's palsy. Charaka ardhita is this one. There are the difference opinion in the name. Treatment all are the same. For your textual reading, always after the class also read the text Charaka. These are the ardhita shloka. I will just what is written. The meaning is the same. First one is samprapti. First point. The shloka number you can write. Need not write the shloka. 38, 39, 40, 41, 42. Shloka number. vatvyadhi.
vatvyadhi chikitsa.
Yeah, chikitsa. Charaka chikitsa. In Ashtanga it is vata nidana also there. Nidana. vatvyadhi nidana.
28 or 20? Which?
Charaka?
Yes.
I think 28.
Shloka number 38.
38 to 42. Only 1, 2, 3, 4, 5 shlokas are there. Just I will read. Ativruddham sharirardhamekam vayo pravadyate. Ativruddham prabala. Vayo balavat prakopama. In the Chakrapani Tika, it is written clearly about the points. Sharirardhamekam, only one side of the body. Vayu pravadyate. It sthana samshaya in the half side of the body. And yada tada upashoshyam asrit bhavum padam cha janucha. Same. Asrit lasika bahu janu shosha. Tasmin sankochayatyarthe. Sankochayati atyarthe. After that one, after affecting the part, sankocha will be there. Spasticity will be there. Mukham jivham karoti cha. The same spastic changes. Sankocha will be in the mukhe and jivha. Vakri karoti, and it makes vakrata. Kutilata or what you can vakrata means rotated or
Curved.
Twisted.
yeah. Karoti nasa, bhru, lalata, akshi, hanustata. All I have written here. Tato vakram rajatyase bhojanam. So due to this one, he cannot put the food into the mouth. It will go other side. This is coordination. Vakram nasikam stabdam netram kathayata. The movement of the ball, eyeball, is not there. He want to tell something, but he cannot tell. Kshatuscha nigrahyate. He want to sneeze, he cannot. He will try to sneeze, but it will stop. Deenam, depressed. Deenam iti agambhira. Deena, depressed. Deenam, jihva samukshipta kala sajjati cha asya I have told just one. Dantas chalanti bhajyate shravano. Karna shravana bhada. Ear ache and hearing problem will be there. Vidyate swara. Swara sound is disturbed. Hoarseness may be there. Pada hastakshi jangoru. Jangavoru Shanka Shravana Gandaru, the paining areas. Ardhe Tasmin Mukhardeva Kevale Syat Tadarpitam. One side is affected, not Keval. Whole body is not affected. We can see the symptoms in the half side of the body. Kevalamiti, particular side. Na Sampurna, Krishna is the name Krishna. Krishna means a whole body. Na Krishna. Kevala, one side. This differential diagnosis I have taken from Chakradatta and Ashtanga Hridaya. From that one I have taken. In that one it is told. And in I think the Vijayakshita Tika also may be there. I have taken mainly this one.
Sir, in which tika?
Pardon me?
Can you repeat please which tika last you mentioned?
Vijayakshita. Madhav Nidana Tika.
Okay.
And Bhav Prakash also it is told very elaborately. I think this is sufficient. Ardita, this is a little tough one. Generally this is asked for the 10-mark question. So you should remember the Samprapti, the sloka, first one is Samprapti, next Lakshana and its pathology. These are there. Nidana, Pravala, Vata. If you are having this, remember, you can write a full 10 marks answer. So I will go.
Sir, I didn't understand why, how it happens that only half body in
Roga
this.
Prabhavena. He is writing as Roga Prabhavena. It is the
it
nature
some
of the
anatomy
disease.
of Srotas like this or?
I will tell you.
This is more
यद्यपि एकपार्श्वयो विकारो अयम् विकारो अयं तथापि प्रभावात् it affects in the different way. More simple. Prabha, dosha prabha. Combination. He cannot assess other way. So he is telling the effect is one side. This is Ardita. Next one is Pakshagata. Little less severe. Pakshagata, comparatively less powerful prakopa of the Vata. Sharira, half side of the body, not the face. And Asrit Sira Snayu, here are less materials are affected. And Cheshta Nivritti, here Sankocha, it is flaccid. Cheshta Nivritti, flaccid. Vakstamba, this is from the Ashtanga they have taken. Vakstamba, unable to speak, maybe that. Sandhi Bandha Vimochana, looseness. Akarmanyata, unable to perform the Karmendriya. And Vichetanata, Samjna, feeling of sense, that is Vichetana, not syncope. Vichetana means movements, and Chetana, Parivartana, changes are not there. Saruja, that is pain. And Lakshana, Sharirardha Simita. Here, this may change one side or it may be other side. Here, Sharirardha Simita, only that place, it won't move other side. Dosha Prakopa, Indriya Vikriti comparatively lesser. And Cheshta Nivritti and Visabhnata is typical in this one. Differential point is this one. This
Samyata means they don't get
unable
the...
to sense. Sensory changes. Next, Ardhangavata, Ekangavata, Sarvangavata. These are the little different. According to the symptoms, we can classify this one. Prakupita Vata, comparatively lesser. Sharirardha Grahana, or one part of the body is monoplegia, we can tell. Sirasnaya Shosha is important, others are not so much important. Pada or Hasta, any one avayava is affected. Shola Todaka, there is pain. And Cheshta Nivritti, Vakrata are there. Visambhnata is not there. In this one. Here Visambhnata is there. And Sarvakalam Vyapya Bhavati. This one all the times will be there. And Ardhangetu Naitani Sarvani Kaunti. In Ardhangavata, just like Ardita, symptoms are not there. Very less symptoms are there. And less symptoms. Ardhangavata. Ardita it is more symptoms. And Vakshagata also more symptoms. Comparing to the Ardhangavata. Okay? Yes, Sadakala, all the time is the same, no remittent or intermittent. This is remittent. Sarvangavata, same, Pragupitavata, Purna Sharira Dharana, Sirasnaya Sankocha, Hastapadadi Sankocha, Sholathoda Kri. This is the differentiation. What are the similarities? Sapekshata. Shuddhavata, all are Shuddhavata Janya. Avayava Indriya Grahana. This dosha Sthana Samshrayinda, Avayava and Indriya. Stira, Snayu, Rakta, Lasika. Here the dosha Sammochan or settling. Indriya, Kriya, Karma, Kshaya or Vikriti. Indriya, Kriya, Karma, Kshaya. Leg also Indriya. Hasta is also Indriya. Vak Indriya. So Karma Indriya are more affected. ಏಕಾಂಗವಾತ ಅರ್ಧಾಂಗವಾತ ಸರ್ವಾಂಗವಾತ ಪಕ್ಷಾಘಾತ ಅರ್ಧಿಕ ಉತ್ತರೋತ್ತರ ಪ್ರಬಲ ದೋಷ ಪ್ರಬಲ ಆವರಣ ಆ್ಯಂಡ್ ಪ್ರಬಲ ಗ್ರಹಣ ಸ್ಥಾನ ಪುಂಜಯ. This is the most powerful ardhika. This is least powerful ekangavata. Okay. Are you clear about this one? Just go and read and if possible refer the book. For your exam this is more important. And generally in the examination ask Pakshagata or the this one, ardhika. And for the short notes anyone may become. In that time you should not confuse about which is this one. If they are asking ardhika, you can try for short notes write the ashtanga there. And if they are asking for full question, write charaka. And if you are write anyone, it is okay. But according to the time, otherwise you can mention the both ardhita of ashtanga there and ardhita of charaka. Or otherwise they ask ardhita of charaka, describe. Okay. Yes, you can ask.
Sir, I have question regarding definition of the pravruta and prakop. What is difference between pravruta and prakop?
Yeah, right. Pravruta means ati sanchita. By that means the prakopa will be more. The quantity of the prakopa, vata is more. Only general the meaning is the same. But the differentiation of the word meaning is pravruta means highly accumulated. Prakopita highly activated. Okay. Generally these are as a used as synonyms, pariyaya.
Yeah.
But that is the actually word meaning is different. Sanchaya, more sanchaya is pravruta. Pravruta, ati sanchita. Prakopita, activated. And it can, the prakopita can vitiate other doshas. Pravruta generally will not vitiate other doshas. Pravruta make sanchar in the body, move to other parts of the body. Prakopita, even though not in a more quantity, it will travel. It traveling faster. Samurchana will be faster, tivra.
Thank you, sir.
Okay. Any what's your doubt?
Sir, so this is Madhyama Roga Marga disease, correct?
Yeah, definitely.
And then means marma will be involved, but is it in any case or depends, like if it's ekanga, then it won't be like, or in any case marma
Kashta.
under risk
No, the pain non can be affected.
in any.
Really, one hand marma will be affected. But ardhita is more severe. So the pranayatana marma may be affected. Whereas others are not so much.
So in treatment we should think how to protect the marmas in this.
The treatment marma is not told about in the treatment.
No.
Those who are treating in the concept of marma, they are doing that one and comparing to the nerve system. And in the chikitsa, Ayurveda chikitsa, charaka or ashtanga, they are not mentioning the treatment of marma. But in the treatment itself, marma will be protected. And the effect of marma means more serious. Marma causes, there are different type of marmas. Rujakara marmas making only more pain. Pranayatana, sadhyo pranahara, all are there. They immediately kill the patient if the point is affected. I am not more familiar with the marmas. Otherwise, you can just see importance of the marmas. In the Sushruta, I think it is more clear. Accordingly, we can have an idea whether the disease are severe or not. Okay? Oh, you can take.
Thank you, sir.
Welcome.